1, 2,
3,
4,
5.
What to Expect When Expecting is the name of a very popular book that women are recommended to read when they are pregnant with their first child. This book outlines all the symptoms that they may experience throughout pregnancy up until delivery. There are many books, blogs, and opinions out there about how to give birth and how to raise a child. But the problem with these resources is that they have very extreme views. For example, one source might tell you to breastfeed your child over bottle feeding, but what they won't tell you is that you have the option to do both. Another problem that they present is when they tell people that they should have a home birth over a hospital birth. They don't tell them about the option of birthing centers that combine the experience of the hospital and the home birth. They also tell patients to have an epidural over going natural. But what they don't tell patients is that there's other options for pain management out there besides an epidural. And while epidurals are an effective form of pain management, there are safer options out there. From my experience as a labor and delivery nurse, I believe that patients should have more pre-hospital education about pain management during labor because epidurals have many unintended consequences. As I said, epidurals are a very popular form of pain management, but many people do not know about the procedure or about its unintended effects. According to the American Pregnancy Association, 50% of patients get an epidural during labor. Did you know that epidurals are actually considered to be analgesic rather than anesthetic? This means that you should not have no pain at all once you have an epidural. This means that if your pain goes from a 10 out of 10 to a 3 or a 4 out of 10, you're considered to have had a successful epidural. This is a common misconception from many people going in to have a baby. The procedure for having an epidural starts by giving a bolus of 500 to 1,000 milliliters of fluid through the IV. When the anesthesia personnel arrives, the patient will assume a certain position while sitting on the side of the bed. This picture demonstrates the correct position. As you can see, the patient's back is arched and their shoulders are pushed forward. This opens up the vertebrae for the anesthesia provider to place the catheter. This picture shows where the catheter will be placed, and that's between L3 and L4. Once the provider places the epidural, the patient will then lay back in the bed and they will begin to feel the effects of the medication in about 20 minutes, starting with numbness in their feet that ascends to their upper abdomen. Epidurals have many consequences. Some of the known side effects of epidurals can be back soreness, a severe headache, and hypotension, according to the Mayo Clinic 2020 article, Labor and Delivery Pain Medications. Some of the unintended consequences can be stalled labor or birth trauma. Hypotension from the epidural can lead to a decreased perfusion of the placenta that brings oxygen and blood to the baby. This will cause fetal decelerations in the heart rate, which can be very dangerous. When the labor is stalled, that means that it's taking longer for the patient to progress to 10 centimeters. This can result in a C-section, or whenever the patient does get to 10 centimeters, they're at risk of having an instrument-assisted delivery because they have no urge to push. An instrument-assisted delivery can cause birth trauma to both the mother and the baby. While this is not common, there is still a risk that the baby could have lacerations to its head after delivery from a vacuum or forceps. And this is according to the Ananoki and Papoudas 2016 article about delivery outcomes. So, now that you know about epidurals, you're probably wondering, well, what are my other options? Well, let me tell you, there are several options out there for pain control that include holistic options, IV pain medications, and nitrous oxide. For patients who prefer to have a natural labor, they have the option of holistic methods that include positional changes, yoga ball, peanut ball, and aromatherapy. These are just the options that are available at my hospital, but in bigger hospitals, they often provide hydrotherapy, which is when the woman can submerge herself in a birthing pool or tub, and the warm water can take away the pain and provide some pain relief. IV pain medications are offered at almost every facility, but the problem with this method is that you can only receive these pain medications until you're about 6 to 7 centimeters. The reason why is because once you get to 6 to 7 centimeters, you're in the transition phase of labor, and many times people progress faster through labor once they hit 6 to 7 centimeters. If you receive the IV pain medication and your baby's born soon after, the baby may have trouble breathing whenever they're born. The next option that I'll talk to you about is nitrous oxide, also known as laughing gas. I found that the best use of nitrous oxide is early use. You should start using this before your pain becomes excruciating because it takes 15 minutes for it to reach its peak effect. When you use nitrous oxide, you will have to hold a mask to your face like oxygen, and you'll inhale through your nose and blow out through your mouth. The medication, or the nitrous oxide, does not have any effects on the baby, and the effect that it has on you is only temporary, which is why you have to continue to hold the mask up to your face. When you inhale, you're inhaling the medication and you have the effects, but when you blow out, the medication is blown away as well. Many patients say that this option takes the edge off of the pain and makes it just bearable, but many people have also complained about it making them feel lightheaded or not themselves. Either way, now you've been taught about other options for pain management. To know what method of pain control is right for you, you should talk with your OBGYN and your nurse prior to giving birth. Research has shown that patients need prenatal education on epidurals, according to Alakili et.al., the effect of education on prima gravida women's decision to request epidural anesthesia. You should stay in communication with your nurse and your doctor to make adjustments to your plan. You may first decide that you only want to try holistic or natural methods like position changes during your labor. But if the pain becomes too strong, you may then want to consider pain medications. From there, you can then decide if you want to try the nitrous oxide or if you are ready for an epidural. But now you know the risk of all the options. Finally, be open-minded to suggestions. Your nurse and doctor may tell you about things that you've not heard before, and you should be open-minded to trying things as long as you've been taught the risks and the benefits of it. In conclusion, epidurals are a commonly used method of pain control during labor. While patients may be informed of the side effects, they may not be familiar with the unintended consequences, such as an increased risk of instrument-assisted delivery, C-section, and birth trauma. To avoid these risks, I encourage you to talk with your OBGYN and nurse prior to delivery. Holistic options, IV pain medications, and nitrous oxide are just a few options that may be better suited for you and your birth goals. It is my recommendation that you consider these options prior to getting an epidural.
One, two,
3,
4,
5.